the first meeting of November, this Rock Ridge School Board meeting to order. Meeting agendas are available for public at the table as you enter the room. Public may also access board agendas by visiting our PS District Info School Board Board Book. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Packing them in here tonight.
We are. Roll call, let the record indicate Director Jody Westby's not here tonight, got stuck at work, so he can't make it. The agenda, I got a couple of ads. We're gonna add a committee update for the meet and confirm meeting that was held
On the 3rd.
November 3rd.
Thank you.
So we'll put that at 5.5. And then we're gonna add
Yeah.
into closed session, we are going to go, should we go 7.3? Go into closed session.
Can we,
Discuss personnel.
can we close the session that's not on, Noel? Yes.
Okay,
I would like to propose, or to put on the agenda to talk about a working session. So can I put that on here? I'd like to be able to talk about the budget early.
okay, so you're requesting a committee meeting of the,
The board for.
that's committee of the whole.
Yep.
So we can just, we don't have to put that on the agenda, I don't think. We can just, because I would like, I agree with you, I'd like to get going on that sooner than later.
Okay.
So,
Got it.
okay,
Okay.
thanks Jennifer, appreciate that.
Sure.
So we'll leave that off the agenda for now. Any other deletions or additions? Can I get a motion to approve the agenda as amended?
So moved.
Second.
Motion by Riddens, second by Westby. Any discussion? All those in favor signify by saying aye. Aye. Opposed? Motion passed unanimously. Recognition of visitor input. Does anybody like to speak? All right. Stace? Stephanie?
Good evening, members of the board. Something absolutely fantastic happened today at the high school. We had 2 members of the community that dropped off 30 food bags. And I'm talking like, for example, this one is pancakes. It's everything you need to make pancakes, spaghetti. 2 members of the community raised $1,500 and made 250 food kits for people in our community. It is absolutely amazing. So I want to give a shout out to Tanya Hoyt, Hoyt, and Heather Clement, who had taken this upon themselves to do something absolutely magnificent for our community based upon, we know that the SNAP benefits are not there. So absolutely amazing. So we had 30 meals that will go out to families tomorrow. So, yeah, so just absolutely amazing. Ladies, if you're listening, thank you so much.
Great.
Yes.
Thanks for sharing. Thank you. Anybody else like to address the board? Okay, moving on. Consent agenda. Can I get a motion to approve the consent agenda?
So moved.
Motion by Colbert, support by Bonner. Discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? Motion passed unanimously. 5.1, Scenic Rivers Health Services presentation by Keith Harvey. Keith, please.
Okay, perfect. All right, well, I've met some of you, I think I know most of you. First of all, I just want to thank you for giving me the opportunity to come talk about this. I really like to do kind of really 2 focuses for this conversation is, one is to let you know who Scenic Rivers is, give you an idea of what we are, what we represent. And then second, talk about the concept of a school-based medical clinic. It's something that's newer, and is growing very fast around the state of Minnesota and countrywide. So I think I'll start out by just kind of jumping in and talking about us as Scenic Rivers. So what Scenic Rivers is we are a federally qualified health center. We were established in 1979, so we've been around for about 46 years. We're a nonprofit 501c3 clinic. We provide primary medical, behavioral health, and dental services. We operate 7 medical clinics, 7 medical and behavioral health clinics, and 4 dental clinics around northeastern Minnesota. So we have clinics in Cook, Big Fork, Tower, Floodwood, Eveleth, North Home, and Big Falls. And I underline Cook, Big Fork, Tower, and Floodwood because that's where our dental clinics are at. I'm gonna kind of buzz through this stuff really fast, so if you have any questions, feel free to stop and ask me, as we're going along. So we have physicians who staff the Cook and Big Fork hospitals, the emergency rooms, the hospitals, and the nursing homes 24/7. So that's a big component of what we do. That's not typical of health centers like us, but that's what we do. We also have an affiliation with the University of Minnesota School of Dentistry. So we provide outreach for dental students from the University of Minnesota. So once a month, we'll have a student come up and stay with us for 3 weeks and essentially practice in our dental clinic at Cook. And we'll also be doing it down in Floodwood. So we have a very close relationship with the University of Minnesota. We've been doing this for about 10 years. Just recently, in the last this last year, we went from having 2 students come up for 3 weeks to 1 student coming up a month, each month of the year. So we're getting to see a whole lot more students. They love coming to our practice because they get to actually practice. When they're at the University of Minnesota practicing, they're using not the best technology, they're not using the best stuff, it's just part of their training. But when they come and work with us, they're actually seeing patients that they're gonna see. We have an excellent dental director who works with these students and helps them work out their issues with patients and everything. So it's really been an outstanding relationship that we've had with the U. And we serve an 8,500 square mile area, 14,000 unduplicated patients, and we have about 52,000 visits on an annual basis. So a lot of people don't even know who we are. And I've always said we might be the best kept secret in northern Minnesota because we have great providers, we provide a lot of service, and we really take care of a lot of people throughout northern Minnesota. So it gives you a little bit of an idea of who we are. Here's a map, and you can see up in the corner there where the little trees and the water flows, that's our clinics. So we cover a big chunk of northeastern Minnesota. I don't think people realize that we were maybe quite as large as that. And then just to let you know, as an FQHC, we fall under the jurisdiction of the Health Resource Service Administration, or it's called HRSA. And with that relationship, we receive an annual federal grant of about $3.5 million. And the purpose of that, well, it's a grant that's a competitive grant, and we're funded through through May 31st of 2028. The reason we get that grant is because we provide services to underserved populations. And I want to just clarify underserved populations. A lot of people think underserved populations are low-income people. Underserved populations are just underserved. And if you look at all of northeastern Minnesota, that's a population that's underserved. We don't have enough providers. And I put up there HPSA, MUP. We're full of acronyms. But the HPSA is a health provider shortage area. And our whole area is a health provider shortage area. I think those of us that live up here know it's hard to get a physician, it's hard to get a dentist. So we fall underneath that. And then the MUA is a medically underserved area. Most of our areas are considered or designated as medically underserved areas. If they're not designated as medically underserved areas, they're an MUP, and they serve a medically underserved population. So that's who we are. We serve underserved populations throughout the area, and that's why we get that grant. Give you a little sense of, there are 17 health centers in the state of Minnesota. Ones that are closest to us are Lake Superior Community Health Center, they're in Duluth. And then there's Sawtooth Mountain Clinic, that's up in Grand Marais. Nationally, there are about 1,600 health centers that serve over 32 million people in the country. So 1 in 10 people are served by health centers. And I wanna talk about this because as a health center, we kind of we take care of everybody. We are there to take care of underserved populations, low-income people, people of all races, or sexual orientation, everything. That's one of the key components of who we are and what we do. At the state level, we have a couple of associations that work with us. We have the Minnesota Association of Community Health Centers, and then nationally, there's this National Association of Community Health Centers. And we're also a member of something called the Breakwater Health Network. That's 4 community health centers regionally that we work together. We actually do all of our medical records through them and our electronic health record. And the reason I'm putting all of this up there for you is I don't want you to think we're just a fly-by-night operation. We've been around for a long time. We provide very valuable services in our communities. And so I think that just wanted to sort of set the stage for why we're coming to Rock Ridge to talk about a school-based health center. So that's just to give you that background. In 2023, the Minnesota legislature defined what a school-based health center was. And it's listed, and you can read it in here, it's kind of hard to read up here. It's school-based health center or comprehensive school-based health center means a safety net healthcare delivery model that is located in or near a school facility and offers comprehensive medical care, including preventive and behavioral health services provided by licensed and quality health professionals in accordance with federal, state, and local law. And it's to all students and youth within the school or district, regardless of ability to pay, insurance coverage, or immigration status. That's in the state statute, was put in 2023. That's kind of the impetus for why I've started really interested in having a school-based clinic somewhere in northern Minnesota. They generally say it needs to be a school that has a population of 750 or more. So naturally, Rock Ridge was the first place that I thought of coming to. I've been talking off and on with Dr. Schmidt for, I don't know, maybe almost a year about the possibility of doing something like that in this school, because it really kind of fits. The next slides, I'm going to kind of buzz through this stuff real quickly because you can read it. And on the back, the very last slide, is my phone number and my email address. And if you have any questions, do not hesitate to call me. And I'd be glad to come back if this moves forward or we do anything with this and talk about more what we want to do. So I'm going to give you just some quick kind of background on what a school-based health center would look like. They are growing too, by the way. And this is just a quick slide to show you that in 2022, 2% of the school districts in the state had school-based health centers. They're predicting by 2026, it'll jump to 10.5%, and that's with only like 8 sponsors and 6 FQHCs that are working. By 2027, they expect to have 29 sponsors. And what a sponsor is an organization like ours. You'd have to have a healthcare or a health entity that would be the sponsor of your clinic. So they basically provide the providers and that type of thing. So it's growing and it's growing fast, and it's a very successful model. Really brings the whole care to kids. Theoretically, they talk about whole school, whole community, whole child model. It's all about the whole child and everything student-centered with an emphasizing the role of community in supporting the school. It also identifies connections between health and academic achievement. That seems to be one of the key components, that kids who are healthy, kids who are taken care of, they don't have to leave school to get their health care, they learn better, they graduate, the graduation rates are higher. There's a whole lot of benefits to that. I don't think I'm going to go into this other than Our medical people would provide treatment, they treat medical conditions, they provide preventative care, they would identify unmet needs and that type of thing. Our behavioral health people would assess patients, they would provide screening for mental health conditions and provide treatment plans and therapy. All of this would be, they'd also assess for referrals if they need to move on to something else or greater care. So this just kind of gives you an idea of what we do and who we are. So what this slide basically is talking about is who we are. School-based clinic offers students equitable access to integrated healthcare that supports their learning, with outcomes of increased attendance and classroom time, improved graduation rates, ensured care continuity with kids, increased school engagement. These are things that have been proven out at other school-based centers. Reduced preventable ER visits. A lot of times kids they go to the ER and they don't need to be going to the ER. We can take care of that here. In school-based health centers, one of the key things is overcoming barriers to healthcare. Obviously, transportation is a big issue. If a student can see a provider in the school, they don't have to be picked up by the parent. The parent doesn't have to leave work. The student doesn't have to leave the school. They can stay in the school, get their healthcare, go right back to class. It's much more efficient, much more effective for both the students and the families. So it's a very positive thing there. Obviously, that reduces time spent away from class, away from school. Language, I don't know that language is that much of a barrier up here, but at our organization, we have the ability to provide interpretive services through a software package for about, it's like 89 different languages. Everything from Chinese to Russian to, Mexican, even Canadian, so. And then financial barriers. Because we take all patients and we also provide services to medical assistants, we can help reduce financial barriers. We provide a sliding fee scale to our patients, so if a patient can't afford it, we work with them to make sure it's affordable to pay for it. We do not, our job is to reduce barriers to care. That's one of the main things that we try to do.
And it's, I just wanted to throw in there too, as an HRSA, a lot of healthcare professions can get their college loans and stuff paid for if they're an HRSA facility.
Right.
Working with low income, so
That's one of our recruitment tools that we use, is having loan repayment.
yeah.
As an FQHC, it's National Health Service Corps, that's who provides the loan repayment. So any of our physicians, nurse practitioners, dentists, they can apply for National Health Service Corps loan repayment. But also at the state level, there's multiple opportunities to get loan repayment through the state of Minnesota because we're a rural provider and we're an FQHC.
Yeah.
So there's just a lot of benefit.
Yeah.
School-based health services, you know what that is. That's your school nurses, that's counselors, that's everybody that's taking care of them. What the difference, and I just want to identify the key differences in that your target populations are students with special needs. And there's a variety of things that will, as a school-based health center, our target population is all students, regardless of their disability status or anything. Our range of services is really comprehensive healthcare services that would be very similar to a community clinic. So we're providing full service clinic services to the students. And we would, it includes expanded mental health. One of the advantages we would have is we would be able to bill Medicaid patients. As an FQHC, we can bill Medicaid patients. A lot of providers won't take patients like that because they can't bill for them or they don't get paid. We get paid a fairly decent rate by that, so it's financially it's good for us. There's some benefits to it for us.
Is that the third-party billing?
Correct.
Okay.
That would be we would bill insurance companies. We would bill Medicare, Medicaid. You probably don't have much Medicare, but there may be some Medicare, disability, that type of thing. We would do all of that billing. That's one of the things. There's no responsibility on the school for that. We're basically just running a clinic within the school and with students being our priority.
Okay.
I know I just threw this up there because the National Association of School Nurses are very closely tied to the School-Based Health Alliance, which is a national alliance of school-based providers. We are a part of the School-Based Health Alliance now, and will continue to be a part of that going forward. So there's a close relationship there. And it says there, one does not replace the need for the other. Each has a distinct and complementary function. So we're not replacing school nurses. We're working with the school nurses to provide care. So I think that's a key thing for people to think, because I've had people ask me, well, are we going to lose our nurses? Absolutely not. They're a critical function in the school.
That just brings up the question I just wrote down, like how would something like this impact our current contracts with like orthopedic associates or Range Mental Health for mental health things?
So I don't think it would impact it at all. I think it would be a complementary service. I'm on the board of Range Mental Health Center, so I've had brief conversations with their executive director about us doing this. We would look to provide some complementary services with them. Behavioral health is a huge component. They have more resources than we probably would in that, so we would want to work closely with them. As far as orthopedic associates goes, they're a specialty clinic. We wouldn't do anything that they do. We would provide probably referrals to them, very possibly contract with them for imaging services so that they would actually benefit from us being there. Many of our physicians and providers refer to orthopedic associates. I think it's a complementary service.
Okay.
So I think we would be able to work very well with them. Actually, I think it's kind of really perfect because we are different and we can work together very closely. Because we just provide primary care. It's just the primary care. We are not a specialty service.
Okay, thank you.
Well, this is just more support for the Centers for Disease, the CDC, Community Preventative Service Task Force recommends school-based health centers as an evidence-based model that improves education and health outcomes. So much of what we do is based on good evidence that we do the job right. And as a member of the Minnesota School-Based, Minnesota School-Based Health Alliance, we're going to be required to report to them specific statistics on how we're doing and what we're doing and how we're improving care and how many patients we're seeing and what types of patients we're seeing, because they're accumulating all this data to see what are best practices and how can you improve. So that's certainly something we would be very involved in. So I think that's a huge component of it, because quality is very important. Let's see. Partner with school staff. You know, you have all your considerations, FERPA and HIPAA. I know FERPA is kind of our HIPAA. So we have to be very careful with confidentiality and consent and making sure that we're being safe with the students and with the school, that all of those considerations are taken into account. But we have opportunities really to work with crisis teams, student support teams. We would probably require, at a minimum, a school-based health center advisory board, which would comprise maybe some board members, school staff, some of our staff, our providers, meet on a regular basis and talk about how things are going to make sure that we're moving forward and doing the things that we need to do. So that's really a very important component of it. One thing helps kids learn. It increases graduation rates. And that's one of Minnesota's strongest indicators of health outcomes. That's a very interesting stat. And SBHCs can address dental pain and poor vision. And I read that, I thought that's very interesting. But if you think about it, vision and dental pain are two of the big indicators of kids who have trouble with pain, especially vision. And our providers will provide vision services for all the kids. And it's just a way of helping them improve their time in the classroom and their education time. So. Kind of helps break down barriers of stigma, transportation costs, and all that type of stuff. Now, let's see. I thought this was an interesting slide because it asked, where would you have gone for the concern you have today if not for a school-based health center? And 40% said they would go to another clinic. So that means they would pull their child out of the school and take them to another clinic, go to that clinic, and then have to bring their child back. If a parent is working, they've got to leave work, they've got to pick up their student, they got to take them to the other clinic. So that's about 40% of where people would go if they weren't doing a school-based clinic. 12% go to the emergency room. I think there would be an opportunity to reduce that number because people go to the emergency room for a lot of reasons they don't need to. And if you have some early intervention with a medical provider, you might be able to reduce that. So save on that time. And then nowhere or don't know. And I think that's the one that concerns me the most because you have people that if you have a child that's sick in school, you don't know where to go, you don't know what to do, they just remain sick. Or they get other kids sick, or they don't get their diabetes taken care of. If they have hypertension or if they have eating disorders or all this stuff, that stuff just doesn't get taken care of. Whereas with the school-based health center, you're focused on the whole child and really taking care of the whole student. So I think that's a very important piece to me. Let's see here. You can look at this, but this is our core competencies. We really want to improve access. It's student-focused. We're spending our time working on students, high-quality care, and that is measured through the School-Based Health Alliance, to make sure that it's the best, highest quality care. We have collaborative school partnerships, so you're working with the school administration, you're working with teachers, you're working with parents, you're working with school board, school wellness, systems coordination. And one of the big ones, and I think this is probably very important for the school board, is sustainability. We're in the process of developing a business model for this. It's not done yet. There's a lot of work that needs to be done. There's a lot of planning that needs to take place. But I think it's important that we have a business model that shows that will be successful, it will be cost effective, and it'll improve care for all the students in the school. That needs to happen. So we need to do that. We've gotten a grant from the state of Minnesota to put this in place. It's a 3-year grant, $187,000. The first $55,000 is to be directed towards planning. We haven't spent any of that money yet. So we have a lot of planning that needs to be done. But frankly, I'm kind of over the top on this because I think this is the best way for a school to go to provide great care for kids. So I'm anxious to get started on it and really move forward. And I guess you look at these 3 components here, is really developing strong partnerships within the community with other providers, with Orthopedic Associates, with Essentia Health, with others that are providing care in the community. Develop those relationships. We already have those relationships and continue to strengthen those. Build a sound business model. It's got to make sense. It's got to financially work for you as well as us. So, and then just make sure it's a high quality practice and make sure we're measuring that to make sure that we're providing the best quality care for the students. And then the last 3 sides are just like, who are the key people involved in this? We talk about a health sponsor. We would be considered, in this instance, the health sponsor because we would be providing the staff, we would do the billing, we provide the providers, we would provide the medical record piece. We are currently in the process of flipping over to the Epic electronic health record. So we will have the same electronic health record as OA has, as Aspires has, as Essentia has, as Fairview has, as the Mayo Clinic has. That should be, we were scheduled to go live on October 28th. It's been pushed back to December 9th, but now it's green light, so we should be doing that. And that's going to be a very good thing. We'll be the one driving quality improvement. Quality improvement is essential for our organization, so we would push that. So then, the next is the planning group, and I think that's probably, if we talk about next steps, is establishing a planning group that can look at this and see how we need to make this work. Certainly the members would be us, school staff, students, families, board members, community members, to put together a group that can see how we can make this thing really be very solid and work well. And those are the responsibilities we kind of leave that that's what they would need to do. And then kind of the third is the school partner. you would have to hopefully provide space for us, because we have to be on or near a school.
How much space would something like this need?
Well, that's remains to be seen. Probably a few thousand square feet. A lot depends on how we establish it. In my vision, I want to see a health clinic, a behavioral health clinic, and a dental clinic. And to me, I think the dental clinic is maybe the most important piece of all of it, because that's probably the greatest need in the area is dental care. The oral health needs in our communities is incredible right now. It's actually at a crisis stage. We are recruiting heavily to bring more dentists to the area. And one good news is we had an interview last week with she's a University of Minnesota graduate, and she's doing a pediatric residency at Hennepin County. So she will technically be a pediatric dentist when she finishes. She's looked us up because we're an FQHC and she wants to work at an FQHC. She grew up in southern Minnesota, but has an interest in working for an organization like ours. She does not know that we're talking about this. And I can hardly wait to tell her that this is on the docket of what we're looking for, because this would fall right into what she wants to do. She wants to be a pediatric dentist. And if she came and worked for us and we didn't have a relationship with the school, she still would do probably all of our pediatrics, which is not a whole lot. Whereas if she's here, she's going to do the vast majority of pediatrics. And that's pretty exciting. We'd have hygiene, and then we need the dental assistants. And I think if you were able to develop something like this, hygiene could be something that is not just done at the two schools here. We could go to the elementary school, we could go to the Laurentian, and set up a chair and say, have kids come in and clean their teeth. I mean, it could be an ongoing basis. I know that there's some of that's going on, but this would be more of a full-time basis that we could do. I think that has great potential. So that, depending on where that all starts to lay, depends on how much square footage we need and also how much construction needs to be done. A medical clinic really needs it needs an office with a table and a chair and a desk and a computer. When you get to dental, now you've got to have some suction, you've got to have gases, you have to have a lot more liquids and that type of thing to take care of it. It can be a smaller setting, but it does create a little bit more investment. We would certainly look at either grant funding for that or borrowing money to do that. I have talked with our bank about if we're able to recruit dental providers. I'm pretty sure we could borrow money to take care of that because it's a pretty lucrative business and we just need to be able to get the dental providers. So, we're working on all that stuff. It's not all in place, but that's sort of the planning stuff that we have to do to move this forward.
At the other school settings, so it's run Monday through Friday during school year.
Correct.
In the summer, what happens then?
Stay open.
It stays open.
Yep, I think because it's, our priority is gonna be the students. But if parents wanna come, we'll take care of parents also. If staff wanna come, we take care of staff. We're our primary care provider. We can provide services to everybody. So it's not just only students, but clearly the priority is students. And, I haven't even talked about the possibility of what the academy concept would do for us, because we would love nothing more, and I've got staff, when I talk about it, their eyes get bright, about being able to work with students. Have students come in and shadow us and actually maybe do some of the work. That's where dental really comes in, because I think the potential for a dental academy alone is huge, because there's such a demand for dentists right now. And, we've talked about bringing in, there's these kits where it's a mouth and you open up the mouth and kids can play with drills and they can do all kinds of stuff and practice with that kind of stuff. But if you had an actual dentist office where they could come in and actually be exposed to it, get them exposed early. Maybe they want to be a dental assistant. Maybe they want to be a hygienist or a dental therapist or not. But give them an opportunity to see, I don't want nothing to do with that, or that's what I want to do. What I find is the people that are in dental, they're like locked into it. If you're not in dental, you want nothing to do. I could never be a dentist. But I look at the dentists that I work with, I don't know how they do it, but they are absolutely in love with what they do. And it's a hands-on working, and they're making a difference in people's lives right now. And so I think it's a great thing. That excites me probably more than anything. So that's kind of all I have. And I guess like the next steps are we need to talk about planning, and if you think let's move forward, we'll continue to move forward and do more of that and prepare more of that.
So I have a question. When kids get you mentioned kids getting dropped off instead of their parents coming and picking them
Right.
up. What kind of safeguards do you have in place that parents are fully a part of?
So there would have to be
Care.
consents in advance. So we have to go through a whole process of making sure that all of the students have consents and everything is in place and they know what they're doing. So they know where they're going, know who they're seeing. We're not just taking a kid off the street.
Yeah.
There are processes to do that. That's where the School-Based Health Alliance is huge, because they have models, they have policy and procedures that fit right into what it's supposed to be.
And then if they say they leave their classroom because they got a bellyache, they go see
nurse.
somebody in your clinic,
Oh.
parents would be notified?
Oh, absolutely.
Yeah.
I would assume they'd go to the school
Yeah,
nurse first and,
Yeah.
and
That's where having that relationship with the
Yeah.
school nurse is critical, because we would offer them an opportunity to take care of some of these situations.
Yeah.
But no, that nurse is really, that's the
Yeah.
key person.
I guess I was going more for if they go to the clinic.
came directly to the
And
clinic.
the parents didn't know that they went to the clinic, they would be notified.
That would be the first priority. You have to notify. And that's where that whole FERPA and HIPAA piece gets into place. You gotta be very careful that you are confidential and you're protecting their data, especially their health data. You can get in a lot of trouble if you don't do that.
Yeah, I guess in my opinion, I think it's very worthy to keep, pursuing this. I think it sounds great. I do have a ton of questions too, but I feel like that is gonna just evolve as we go.
Sure.
But I do think it's very worthy just because of the academies, and I do think there's a huge need in our population
Yeah,
for healthcare, especially for our kids. So I do see it as a good thing and worthy of pursuing. I know we're gonna have a ton of questions, but
Yeah.
I do see that they'll
Keith's-
figure it out as we
He's
keep
the
going.
answer man too.
He's got his phone number
If I don't
on the
have
last
answers, I'll
page.
find the ones who get the answers.
Yeah, because it's a new thing for all of us, so
Right.
it's how
Yep.
exactly is this gonna
And
work?
actually, it's kind of a new thing for me. I mean, I've been looking at it for the last couple of years. I had gone to a conference where it was talking about innovative ways to strengthen health centers. School-based clinics was number one on the list because it's such an effective way to help build the community and work with the community. And I think it's a good thing.
And it comes down to money.
It always comes down to
It always comes down to money. Can't do it if there isn't the money to do it, so.
But I like the grant funding,
Yes,
Yes.
yes, and I know the school has applied for some grant funding, and we are looking at some other options for funding also. Have had conversations with IRRB folks. They probably wouldn't fund our operation in any way, but they would consider funding the construction. If there's work that needs to be done, that's something that falls into those buckets that they have, which could be either in a loan format or in a direct grant. So we would definitely pursue that. Delta Dental Foundation, they have been a huge funder of ours in the past. They love this concept. The University of Minnesota is all over it. They think it is the future of where things need to go. And one thing I'll tell you that these students that come up to see us, they're gonna work 4 days a week, Monday through Thursday. They have Friday off. And I was just talking to Angie Hastings, she's the director of the outreach program. Get those students in the school. So we'll bring them here on a Friday, and I've talked to Willie about this a bit. They can come in and just spend time with students. They're not necessarily gonna do any dental work, but they'll talk to them about their oral health problems and talk about different things and really help to educate the students on the importance of oral health. I've only been with dental practice for about 10 years. My whole private before that was with clinics and hospitals. To me, the dental world is so important. We have neglected it for years. It's always appeared to be like, you've got medical over here and dental is something different. Well, they're the same. They are so critical. They work hand in hand. What goes on in this place affects your entire body. So you've got to take care of your oral health needs, especially for kids growing up. They need to know how to do that. They need to know the importance of that. So that's where I think that's what gets me really jacked up about this. So.
Good. Thanks, Keith.
yeah.
So continue the conversation, I guess, huh? Just
Okay.
keep planning, I think, is.
Okay, excellent.
Dr. Schmidt.
And you guys have on the back page there at the bottom is my phone number. And email this if you have questions. please send me questions or give me a call. Yeah. I'd love to talk about it. If I don't have the answers, I'll find people that do.
Okay.
Okay,
Thank you.
thanks, Keith.
Great, thanks.
Now Angie's gotta beat that.
Yeah.
I won't be that loud.
Laurentian Elementary Report, Principal's Report, Angie Williams.
Good evening. I have Stephanie up here because I wanted to start off with a little bit of a show and tell of what we have going on for our early childhood family education class. Shannon Cush Jeffrey has always wanted to have a cooking class, so cooking with kids finally came to a reality. So they have these wonderful little aprons that have the Rockridge logo. And little 2 to 5 year olds have these little cute little hats that they put on. It's offered every Friday at Laurentian Elementary with in our community room, which has the stove and the fridge and the tables. And then they have these little kitchen tools that they use. And it's just the cutest thing, those kids with their parents learning about kitchen safety, learning how to use, you know, the cutting skills, and they're trying different foods in that course. So we have one more Friday, and that wraps up the 4 Fridays that they have. But thank you for explaining that.
Very cute.
Great.
It's super cute.
Well, yeah, I bet.
I love it. And Ellen Evidence, the teacher, she's doing a fabulous job with that class for the parents and for the students. I also wanted to mention just today, we had an in-service day, as you know, no students in our buildings, but we had our teachers being trained. Elementary, we're at the Parkview Elementary, and we had our district literacy lead talk about the English language arts standards, because they are implementing new standards and in the English department. And then we had Angie Lloyd from our coach from Leader and Me, working with our grade levels on their WIGs, which are wildly important goals. So on the classroom goals setting and student goals. And then our paras were also being trained today. They were all at the high school, and the paras were able to choose from some different options from our occupational therapists and from our speech language pathologists. Some of those courses, I wrote them down here, I just have to find them. Like one was making sense of sensory in the classroom. Another option was how our calm creates their calm. Supporting communication for non-speaking to limited verbal students. So these were just a couple samples that I mentioned, but there were others. And the paras were able to sign up for what they wanted to be trained in. And then they also had their third session in that structured literacy. If you remember from September when I spoke to the board, the paraprofessionals are receiving 4 2-hour trainings throughout the year on structured literacy. So we've just completed their third one today, and they'll have one more 2-hour session on structured literacy that will build into a staff development day coming up. So it was a very busy day today, lots of learning going on. I also wanted to highlight a couple of things that I highlighted at a staff meeting today about our MCA scores that I was really proud of the Laurentian elementary staff. This last year, whenever we can get 70% or above proficient in math or reading or science, I mean, I think it needs to be acknowledged. And we had our 5th grade last spring that they scored 70% proficient in reading, and the state was at 54%. And we always want to be above the state average, right? Always want to be. So anytime we can be, 20 percentage points above or so, that's great. And in the 70% being proficient. And then, and I think it was 6th grade was 70%. I might have confused that. The 5th grade was 72%. So 6th grade last year was 70%, with the state being 54% proficient. And then last year, our 5th graders were 72% proficient in reading, and the state was at 57% at the state level. So we're definitely seeing some improvements going into the right directions. I also want to talk about the FastBridge testing. So the FastBridge testing last year, when we looked at our A reading scores in the fall, And FastBridge measures foundational skills. So the MCAs are more rigorous by far. The FastBridge is just making sure that we are getting our foundational skills and that we don't have any gaps in the foundational skills. Last year when they first came in for 2nd through 6th grade in reading, we had about 65% of our kids were proficient, had those foundational skills. And this fall, when we tested them 2nd through 6th grade again, they're at 75% were proficient with their foundational skills. So again, that's just more data that we're seeing that what we're doing, if we do it with intentionality, with that, we can get these kids to be 80% where we would like everybody, 80% or above. And our math scores were about the same. We had 67% proficient in foundational skills last fall, and then this fall that just passed, we were at 72% in foundational skills in math. So as long as we can keep those scores going up, we're doing good. The last thing that I mentioned to staff about too is our attendance. So there's a report that MDE puts out every year about the North Star accountability. It's not North Star like our North Star Elementary, but it's a North Star accountability that they, every year it comes out and they identify schools every 3 years. If their scores are low in certain areas, then you'll become a school that needs to be on an improvement plan. But we weren't identified, which is a good thing. There wasn't any school in Rockridge Public Schools that was identified. But we had really good, consistent attendance data at Laurentian Elementary, which means 90%, we had 81% of our students have consistent attendance. And what that means is that 81% of our students was at school 90% of the time. So they want to shoot for 90% of our students being at school 90% of the time is the goal that MDE has. And we were at, like I said, 81, and that's really good. I think the state was at about 75% of the students statewide are at school 90% of the time. So, you know, hats off to our Laurentian staff for the good MCA scores, FastBridge scores, and consistent attendance as well, and to our families.
Yes.
For helping, supporting that and getting the kids to school. Because if the kids are in school, we can do things, but we need to get them there.
Yeah.
So that was some highlights. We go to Starbase every year, as you know, and this year I was able to go on a Friday because we had a teacher that had taken a personal day on Friday. So I said, well, I'll just go, let's not get a sub, because I like to go and then I can interact with the kids. And the day I was there, they had an engineering problem that they had to solve. They had a plastic egg that they had limited supplies on how to build something that would protect that egg as it went down a zip line. So the zip line was started up at the ceiling and it went down and it crashed into a wall. And the goal was to create something where that egg would stay whole and not crack when it hit the wall. And so the kids really enjoyed that hands-on experiment. They were doing the soft skills like communicating and collaborating with each other. They had to work with a budget, so they only received like $500 in cash. And then I was the cashier and I was selling the supplies. And there was limited supplies, so they had to really think, what do they really want to use to make a structure and engineer and create a structure that's going to protect that egg. They could buy paper clips, plastic wrap, cotton balls, and a few other things too that they could buy from me. But it really had them, you know, problem solving and engineering. And I think it's a lot of things that they won't forget about because it was such a neat experience. And when that first one was a success story, it erupted in that room. You couldn't even hear anything. They were screaming so loud when that first team built the first one where the egg didn't break, but they had to continually go back and revamp and re-edit and redo things and work together. So that was a really neat experience to witness that and be part of that. Also want to mention, last year we had made it a goal to make sure every one of our students received a positive message from staff. And it could be paras, it could be a bus driver, it could be Teachers, secretary sends them out, lunch aides, I've told lunch aides, you know, if you see something good, give them a good ticket, or we've got these Wolverine cards. So everybody contributed to it, and last year we fell short with just a handful of students. We were at 98%, 98.9 to be exact, students that were recognized, so it was just a handful that we didn't get to. So we're gonna continue that goal, and our goal is to get 100% of our students with a positive message. And this year so far, we've had 154 students out of the 466 students that we have receive a positive note, so we're on track. That's about 33% of our students. And then 201 positive messages have been sent out in the first 47 days of school. So that's averaging about four positive notes going home a day, which is good. So we're off to a good start with that. And then we had our conferences October 21st, 23rd. They went well. We've had our bus and fire safety as we normally do. I had mentioned the last time I was here about Orbit Earth Expo. Our PTA had sponsored them coming to our gym and doing a presentation, so we had that. We had Mark Mint, the author and illustrator of the Coda, the Warrior Children's Book Series come. I know Sheena Stefanich mentioned that last time, and Maria Pottersay, who's in the audience here, Indigenous Ed coordinator, she helped coordinate that, and nothing but good remarks from students and from the staff, so that was good to have. Our sixth grade went to the STEAM showcase in Hibbing. Our kindergartners did their annual trip to the Simics farm and received a pumpkin. We had our Stars of Honor program through the University of Minnesota. I know Brandy, a few years ago, you had mentioned that to us, and we keep doing that. And this year, the students that were selected for their hard work and their commitment to excellence, they were invited to a football game, University of Minnesota against Michigan it was. And that was just on November 1st. And I asked for the first time, I said, how many students actually went and got tickets? And there were quite a few. There was like 10 to 15 families that ended up going down there with their child to be recognized during, in between the games there. So that was a nice thing that the University of Minnesota does for our students, acknowledging them. And then some future things coming up. We have our Veterans Day program tomorrow. Our ambassadors always put that together, and it's for our student body that we do in our heart space where our cafeteria is. We'll have that going on tomorrow at 9:30. The end of the first trimester is the 24th of this month, so that's coming very quickly. And then December 4th, we'll have our sixth grade band concert. December 18th, we have our 6th through 12th grade orchestra concert. And then January 13th and 15th, we'll have our K1 and 5 music programs at Laurentian because they are at semester based. And then our 2nd, 3rd, and 4th grade will be in May of this year for our music programs. There's a lot going on.
How's the busing going with the 4-year-olds to Parkview? Is that the age that goes to Parkview?
The 4-year-olds go to
Yes.
Parkview. Wonderful.
It is?
Yes. Yes,
Okay.
it's going really well. It's very well organized. We've got enough staff there to support them.
Okay.
Get them on the bus. There's an adult with them on the bus to and from. So yeah, everything's been going really well.
Oh, good.
Yeah.
Glad to hear that.
Got anything else for me?
No, thanks, Angie.
Great report.
Thanks, Andrew.
Thank you.
Thanks, Angie.
5.3, Superintendent's Report, Dr. Schmidt.
I have one thing to update the board on. Thank you, Director Yuhan. And this is you have in front of you. We do not have dates set for the information dialogue and listening session, but what I have in front of you, you've seen this in a different format. This is a rough draft of potential slideshow that the people would see who come to each one of these. And I'm thinking that I'm going to quickly go through it, and then you can tell me what's missing, if you want something added or changed. This is strictly a rough draft. The colors might not stay the same. Format could change a little bit, but I want you to see what is coming up. And the idea is, I think, for people who come to each one of these, is they walk away with something in their hands. Because we want them to go home, sit around the kitchen table, stare at it, talk to neighbors, bring it over and let other people look at it too. It's not supposed to be a mystery or anything hidden. And in addition to this, we're hitting the high points, the highest points that were brought up. So you're not going to find information about what was the plan to merge the two junior high football teams together back in 2022. That stuff's not in here. The important stuff, what we said, what the board said in 2018 and 19, and what actually happened, those are the big things. So I'm going to quickly go through it. I page numbered this. On page number 2, these are the big questions we're going to be asking. Have we kept our promises? How are we doing? Then any feedback or advice to the school board. On page 3, you've seen this slide before. Most of the community has not, just to see what inflation has done just for the Rockridge School District alone. The next page, you've seen this one too. I'm on page number 4. This is what's happening. The projections are for the population in Northeast Minnesota compared to other parts of the state of Minnesota. Number 5, this is the basic format that I'll go through with the community members who show up. On the left-hand side this is what we said in 2019 and 2020, and I took all of this stuff directly from any informational flyer or brochure that the community saw. None of this is made up. I even put it in the exact verbiage that was said back in 2019-2020. And then on the right, what actually happened. So that's the format for the next slides, most of them. Number 6, way back in 2018, we said we were going to have a whole bunch of committees look into. There were 5 committees. You can see what they were. What happened on the right side? Yeah, all 5 of those committees met. They were met at Parkview. There were over 40 people who met on the summer and fall of 2018. Number 7, what did we say? We said we were going to build a high school based on career academies. What actually happened in those 6-7 years? Yeah, you did. You built a high school career academy that just won a major award for the best educationally designed building in the world. Number 8, we said back then that we were going to organize these academies into 4 high school career academies. So what happened? On the right, we did that. You can see what those 4 academies are that were organized into. On page 9, we said we wanted to create more college into schools. We wanted more advanced placement courses. What happened? We now have 23 college into schools courses and 2 advanced placement courses in the high school. On slide 10, back then, we said that, okay, we want a high school career academy, but we want an academy whether they're going to a 4-year or a 2-year or a technical school or apprenticeship, or even if they want to go to the workforce. So what happened? Now, in blue, I got notes to myself. I'll take those off when the final ones are built. But the next 3 pages, you've seen this also. Willie Speltz was up here with Scott Manny. You can see the main big 3 academies, and you can see all of the pathways. And this one you kind of have to look at for a few minutes. But I want people to see it because we said we wanted multiple pathways for it didn't matter where kids were going to school. And this is what happened. We did. So that's what those next 3 pages are. On number 14, we said, hey, we're also going to build 2 elementary schools. And we wanted them to have unique spaces. We wanted kids to have what's relevant, hands-on. This is the exact wording that was used in 2018, 2019. So what happened? We did build 2 new elementary schools. They do have modern spaces. They do have spaces for hands-on, project-based, and collaborative learning. And maybe I include some pictures or not, I don't know yet. So we did that. On the next slide, we also said, okay, where are these going to be built? Remember, this was a big deal back then. Where are these going to be built? So we said we were going to build a new high school and 2 new elementary buildings at these locations. And in 2019, On the next page, you can see, this is an exact picture from some informational stuff. You can see in the yellow, we said we were gonna build, we didn't know it was called North Star at the time, but the elementary school in Virginia, you can see where that one was going to be built. It's right where it is right now. We said, we didn't know it was Laurentian at the time. We hadn't determined that, but we knew we had a site. It was up here. And that's exactly where the Evelyn Gilbert Elementary School at the time, that's what we called it. And then you can see where the high school was, and it is built right exactly on the location. So they were all built where the school board said they were gonna build them. On 17, okay, what was the tax impact? So on the next page, and you've seen this before, this is the actual tax impact page that people saw back in 2019. And they can look it up and they can see, based upon the value of their house, how much extra taxes was going to happen, whether it's a business or whether it's a residential housing. And then I'm gonna go to 21, because I'm changing the order, so I'm gonna put 21 next. So look on slide 21, I'll change the slides when people see them. So what exactly has happened to housing prices from 2019 to 2020? And so on the left, these numbers came from the actual materials we told the community that the house values were. And at that time, remember, we had people who were worrying that values were gonna go down because they were gonna be taxed too heavily or something like that. Well, you can see what really happened is that the house values have almost doubled now since that time. Now, that's not necessarily because the schools were built, but the walkaway is, since this school board back in 2018-19 said, I remember this, that the home values are probably gonna at least gonna go up. They're not gonna go down. There's no evidence that home values went down from the time that these were all built. Now, page 19 on yours, we also said that we wanted to build unique buildings. We wanted them to actually be environments, and this is a big deal. We went through huge meetings with teachers, with community, with kids. What kind of spaces do you want? And they said they wanted spaces that were designed to inspire. This is actually what we said, actually what was said back in 2018-19. Spaces to inspire passion and joy, and have spaces for real-world application and meaningful integration of community professionals. And then on the right, well, what actually happened? And I won't read all of this, but we have the facilities are great. Everybody who sees the facilities goes, wow. We have speakers coming in constantly to talk about real-world applications. We have classes with real-world applications, project-based learning. We have nursing programs, CNA. The kids just got done building incredible fish houses. And last year, you heard Willie and Scott talk about 120 kids went off-site to go to businesses so they could actually talk to a real HVAC person, meet a real plumber, judge, nurse, whatever they wanted to go into. So they had a better idea of how things worked. And then on slide 20, in 2018-19, we wanted that there to be some economic benefits that revives the communities, improves home values, and serves as an attraction and retention tool for employers. Well, I know that when IRRR is talking to potential new businesses, they are touting the schools here. And anyone who comes into the building is going, wow, this is where can I go back to school? I want to go back to school. So they're seeing, they like where their kids could be going to school. On 22, okay, who's going to pay for all of this? This sounds all good. So this is what the board said way back when, and this took about a year to figure out where's all this money going to come from. And so at that point in time, and this is taken exactly from the materials, information materials, IRRR was going to contribute $4.9 million for 20 years. The state of Minnesota, because we got some state laws changed and we used Virginia's better rate at the time. And state of Minnesota was gonna chip in that much, and 6 million, and then the local taxpayers were going to chip in 2.7 for 20 years. What happened?
Exactly.
Exactly what the board said was gonna happen. That's what's happened. And actually, we're actually 5 years into paying it off, if you can actually believe that. There's only 15 years left.
It's crazy.
We also, in 23, we also said we wanted secure building entrances for safe learning environments. We have them. All of the new buildings have new secure entrances, and we can lock down wings with the press of a button. On 24, we also wanted all the buildings to address the Americans with Disabilities compliance concerns, because this is probably most notable in the Old Virginia High School. If you were in a wheelchair or had mobility issues, it was almost impossible to get into that auditorium. So now it's very easy. We don't have those issues anymore. 25, what was going to happen to the older buildings? This is the exact language that the board used in 1819 with the public, where the board said, we will try to redevelop, we will try to repurpose, we'll work with the cities, but if we can't find anybody to buy them, we're going to bring them down. What happened? They're all down except for what the city of Elbeth wanted. We were not able to find economically viable things to do with the older buildings or people to buy them. 26, what about the number of students? For an example, in 1970, Virginia all by itself, this is the actual example that was used, had 3,348 students. And that was a staggering population decline from then to 2018-19. What's happened now? The number of students we have now, which is about 2,151, we're still 1,197 students under what the old Virginia district had in 1970. So the population decline, it's still happening, which we knew. Number 27, this is one that's come up. So the question was, does it cost more operationally to run our current older building? We're worried about the cost, how much it's costing. So there's a lot of things that went into this, so I just looked at the easiest one to measure that would make more sense to people. So back in 2018, both Evelyn, Gilbert, and Virginia were spending $1.42 million on electric, sewer, heat, garbage. That is exactly what they were spending in 2018. Last year at the fiscal year, on those same measurable items, Rockbridge spent $1.205 million in electric, sewer, heat, and garbage. So then I adjusted it for inflation to see, okay, because those aren't real dollars, 1918 to 25, that's not the real dollars. So in 2018 dollars, what would that really be? It would be $810,000. So your electric and utility bills from what the old district were paying have actually in real dollars gone down about $600,000. So that's what this slide shows. On 28, bus routes came up. What are we going to do with buses? Do we really need to be sending buses all over the place? So back then, this is the exact wording. We were looking at each bus costing extra route. In short, we said we maybe can cut some buses and get some buses out of them. We thought $33,000 a year it cost to drive a bus. We thought in 2018-19 we could eliminate 5 bus routes. What actually happened? 2025, you have 5 fewer bus routes, or a savings about $190,000 a year. 29, if we consolidate, will we save any money on administration? So here's what happened since 2018-19. On the right, you can see what happened. Rockbridge now has 1 fewer superintendent, there's 1 fewer business manager, there's 1 fewer buildings and grounds on the admin side, and there's 1 fewer, this one is merged, HR, fundraising, school to work. If you think Michelle Ufford, remember when she was working for us, that position doesn't exist anymore. That was eliminated. And it was $490,000 reductions. The second to the last slide, 30, we also said back then that we would have fewer custodians because money was a big thing back then. Part of the, if we consolidate, if we work together, we're gonna save any money. So back then, the board said, we think we're gonna need fewer custodians. So what's happened since that time is that we have gone from 30 custodian-type positions to 26 custodian-type positions. We have 4 fewer, about 280,000. Once I get through this with the community, then I'd like to hear from them, and I'll have a system set up so they can tell us, and you'll get all of these answers back. Have we kept our promises from 2018 to 2025? How are we currently doing? And then the most important one probably is any feedback or advice you'd like to give to the school board. And I'm thinking that to run, when you see these, you're gonna go, geez, do you have to have so many community meetings? I think so, because I think I would prefer that if frankly 0 to 10 people are at each meeting, because then you can talk to them and they can talk and you just get better feedback rather than 30 or 40 or 50 people. So we'll have, I'm thinking 6 in Gilbert, 6 in Evelyn, 6 in Virginia. We'll run them pretty close together. Some will be at 9 o'clock, noon, and 5 or 6 at night, so people can make whichever one works for them. And if I can get it to work, maybe have a couple online ones for people who can't make it. Could they Zoom in and could we do this? I think looking to see if we can do something like that. So I'd be interested in any feedback that the board might have as far as what you want to add, remove, or before these, I would finalize it.
There's no maps, there's no drawings, there's,
No Yeti.
huh?
No Yeti.
There's not a Yeti.
I was trying to spare the.
There's not a river, there's no celebration, there's no celebration picture.
Yeah, I know. This one is more
To the point.
pure informative.
I like the staggered times, that's for sure, because everybody works different hours, so that's good.
Yeah.
Sure.
You want to add the donations on the source of money?
Oh, that's a good one.
What slide is that?
That number 22,
Two?
add a 4th bullet point of how much money that we've raised, the donations. And
Oh, that's right.
Yeah.
That would be great, yeah.
And I even think on that same page, with number 3, it'd say when it started, because it says 20 years. Let's say that we're already into it for 5 years.
What slide is that?
On 22, on the left-hand side,
Oh, yep.
I think we should put that, because I was gonna ask that question when it
Yeah.
started, so I think that would be. I'll look at this more closely and I'll email you.
Yep, and you can email me or call me.
Yeah, okay.
You got about a week.
Oh, okay.
Anything else for Dr. Schmidt? Okay. Thank you, Brad.
Yeah.
Now moving along. Treasurer's report 5.4, can I get a motion?
I'll make a motion.
Motion by Bonner,
Support.
support by Reardon, any discussion? All those in favor signify by saying aye. Aye. Opposed? Motion passed unanimously. 5.5, we're gonna get an update from the meet and confer with the teachers on November 4th.
Thank you for adding that. I just wanted to give everybody an update about what the agenda items were and basic information about concerns that teachers had when they came and spoke to us. But the agenda items were, as we've all seen, there's been a lot of emails in regard to the elementary school counselors and the loss of them in the school. Parkview staff came and expressed how difficult the school year has been here at the start without having Sheena there full-time or a principal there full-time. And basically wanted the board to be aware that when Sheena's not there, they don't have a backup person. They don't have a dean, they don't have a backup person there to handle any of the issues that come up. And with her being out and then also with the elementary school counselors not being there, they want us to hear that they're really concerned about, they're feeling a lack of support, I think, with mental health issues in the building. And then, like I said, with Sheena being gone, and it was a concern, as you've seen with the emails. One of the things that I wanted to mention or to ask was, you know, we've talked before about having somebody looking into grants and things. Have we done any of that? Looking into grants for funding elementary school counselors, school social workers, anything like that? Like he mentioned earlier about some grants that we're looking at. Are we going, you know, getting any further on a plan for
Active.
bringing them back? Yeah, and same with the principal issue. You know, I said that I would be willing to support, you know, sharing that principal for this school year, but the hope is that next year we have somebody in, you know, all the buildings. So are we any further on looking at any grants, and who is that person? Who is looking at grants?
So on that topic, first of all, about the principal, and we said last year that it was a one-year deal. That's not sustainable, so I fully expect, and I'm sure we'll end up talking about it at the work study session on the budget for next year, and I'm sure there'll be more than one, that I think that principal has to come back, rather than going back and forth between the buildings. On the topic, yes, we just did fill out a major grant. Cassandra Haney just got done doing a grant. It's related to the scenic rivers that we could tie into with that. And if we can get that grant with their grant money, then we can do something with them. Other grants, no, we have not been successful. They've dried up considerably. The federal money for those grants is not what it used to be. So the largest one that we probably believe we have a decent shot at is the one that we just filled out for the health, but that includes behavioral health in addition to just the general practice that you heard about.
And is Willie the one that's working on this, or that,
Cassandra Haney.
Sandra Haney.
oh, just
Yeah.
Cassandra? Oh, I thought Willie, it was part of Willie's too, this last,
Well, yes, Willie's involved, yes.
Yes,
There's
okay.
no way he can't be involved,
okay,
so, especially with the Career Academy.
that's what I thought, on his new job description.
Well, and one of the things, I mean, you know, when people have reached out to me, I've responded, you know, I'm not quite sure what we can do for this school year. You know, because we've already passed a budget for this school year and made the cuts that we felt, you know, we could somewhat live with. But that's the other thing that came out of that confirm meeting, is just the importance of us getting going on a budget sooner than later. And also the importance, you know, reiterating the importance of us passing a budget in a good time frame and not waiting until, you know, keep going, you know, passing it down to another meeting, whatever, you know, approving it quicker, discussing it quicker. You know, they just wanted to make sure that we're on top of it so we can address some of these needs that they feel are really impacting them right now. So there was a lot of discussion on that. I mentioned about the staff concerns that there's no backup at Parkview when Sheena's gone. And whereas the North Star has Byron there. So concerns about that. Working on the budget earlier, there was discussion about teacher observations and just the basic process, what they can anticipate, you know, going forward. I don't
No,
know.
and that's because I am doing some teacher observations this year. And that's also for teacher observation, but it's also the principals are coming with me. And it's partly for their own staff development, so they can see how I'm doing the teacher evaluations, but we're following the same process. We're not changing any of that with the teachers for this year.
Okay, because, and you know, I think, let me just see if there's any other notes here that I had written down, because I think that was basically reiterated by the principals that were there that, you know, you're kind of doing staff development things with them. Let me see. Oh, another big thing, another big discussion was about schedules, and Scott's here too, but just about the importance that, you know, we need to have like a master schedule done, preferably in February and at the very latest, like March, so that we can be tackling more of the PSEO issues and stuff like that. So that was a big discussion too.
We're hoping to have that actually done in January for juniors and seniors, so our kids can register earlier than the other kids before they're making some other decisions.
Okay, because those were kind of the top discussions of the meet and confirm meeting. And I just wanted to bring it up because I know that you weren't able to attend that either. And I am sure that they're feeling impacted by the lack of elementary school counselors and, you know, the amount of behaviors and social needs that kids have. So just wanted to make sure everybody was up to speed on it.
Do we have any plan or something that we could do temporarily for Parkview right now?
I'm glad you asked, because we are posting for and the board would have to approve this if this happened. We are posting for another behavioral para. You can't fix it really any other way right now at this point in the year. To have another support person when Sheena's not in the building, so if we get the right person, that there's another person who's just focusing on behavior. Now Sheena's pretty close by car, so she can be there very fast. We're only talking about less than 5 minutes between the buildings. So, but that's not gonna work in the long run. That'll work for this year and that's it. But we are looking for another person to help out a little bit more with the behavior at Parkview.
Okay.
Yeah, that, so it was said specifically that you wanted to give insight on post observations.
Yep.
And that the
what
model
that is-
with mechanisms hasn't changed.
And what that means is, for those who are watching, so when we do a teacher observation, when it's over with, then we talk to the teacher about what happened, ask them how things went and what they were trying to accomplish and what actually happened. That's the post-observation. So with the ones I'm doing, I'm the one doing it with talking with the teacher, and the principal is watching to see how I'm doing it, so they can also get another viewpoint on how to do these
So
post-op.
like the notes that you're taking or whatever isn't going to be a part of their evaluation, that's in their paperwork for
Yep.
their
Right, but the
evaluation.
principal's still doing all the paperwork just like they normally would do.
So your part isn't in there.
No,
Okay.
it would be, because I can do a teacher observation just like an administrator can. I did these for many years. So the actual results of the evaluation, yeah, they'd be in there, just like they normally would when a principal does it.
Were they not liking that?
Well, I don't know necessarily if I would say that, but it's just a matter of, you know, the frequency you're in, I think, and anybody else can correct me if I'm wrong, but I think part of it is just the frequency of your being in the buildings and then doing those evaluations and not necessarily being in those buildings as frequently, whereas their building principal is there, you know, frequently knows the things that are going on, whatever, with their classrooms individually. I'm just trying to read
If
my
I could
notes.
interject a little bit, because I was there too. I did think that the principals handled that really well, because I think there was just clarification that the teachers were looking for. They were kind of freaked out. Why is the superintendent there and what's going on? Has the process changed? And, you know, the principals reassured them that it hasn't changed and kind of explained what was going on, and it seemed to satisfy,
Yeah,
Okay.
in my opinion.
yeah.
One thing that, over the last 4 years, that has been said by many staff members is, when Noel was first here, Noel was in the buildings a lot more. Why isn't he? I said, well, we're tearing down buildings, we're building new buildings, you know, blah, blah, blah. Now he's in the buildings again and people are going, why is he in the building? So, yeah, it's 6 1, half a dozen of the other.
Good point.
So like I said, I just wanted to give everybody information on what was discussed in that meeting, especially since we got a lot of emails over the last week. I feel like I've gotten a lot of emails about, you know, the lack of elementary school counselors in the building and just no coverage at Parkview and stuff, so. Just keeping everybody informed.
Yeah, one other thing, and which I think was really important, is to talk about, the behaviors in Parkview, and I do think that we can help with that, like Dr. Schmidt said. The other thing that, like Brandy said, we did talk extensively about was the PSEO, and I just thought this was interesting information because that is an issue, something that we obviously want to keep the kids in our building, and I know that like Mr. Manny's working on it. A lot of people are working on it to try to make that possible. Like if we could offer an AA degree. But just to note, which I thought was good to know, there's 193 seniors that are PSEO right now and 137 juniors. It's a lot of kids. So it's just,
We don't have that many.
well, that's what they're telling me. 193 senior, am I wrong on that?
Yeah.
Not the wrong, that is a lot of, that is too many, isn't it?
There's 197 seniors in the building and 130,
I'm sorry, see, I knew,
roughly
okay.
about 100 PSEO students.
Oh, 80, I'm sorry, 80 seniors.
80
Right?
seniors are PSEO, yes.
And then 22 juniors, okay, yeah,
Oh, wow.
sorry, I
Still-
can't read my notes.
Still too many.
Still too many, that was a lot, yeah.
And I think I brought it up last, ARC, who does our student information and many other things, because of the superintendents in the area asked, all the way from Aiken, all the way to International Falls, the amount of PSCEO is costing our districts, total revenue lost just this year, $6.5 million to our local schools is going to the colleges.
Yeah. So that's all I had.
Okay, thank you for that.
Yep.
Policies, second reading, 6.1 through 6.20. Anybody?
I will make a motion to approve all of the second reading policies.
Motion by Lotiger,
I'll second.
second by Colbert-Dahl. Any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion passed unanimously. Admin, Indigenous, 7.1, Indigenous Education Grant Update and Request. Thanks for your patience, ladies.
Hello, I'm Maria Pomerzay. I'm the Indigenous Ed Director. And this is Lily Walker. She is our APAC Vice President. So we are here to give an update about what's been going on in the Indigenous Ed program. We received a very large grant in March. The state was behind on getting this grant to us, so it was supposed to be a 2-year grant. And like I said, we received it in March. So I only have until this school year to spend all of this money. I hired an Ojibwe language teacher. He has been going to all 4 of the buildings, which has been amazing. He's teaching the kids Ojibwe culture, crafts, anything that he wants to do. But like I said, there's this sum of money that I need to spend, and we have ordered curriculum. I brought in a guest speaker to all 4 of the schools, and I'm left with over $200,000. So myself and the APAC board agreed that some of the money should be used for pay increases. So I have 2 tutors, and I would like their, as you can see in my proposal, I would like their pay increase to go $19.25 to $19.97 for the school year, and then my wage would go up as well. Would you like to add anything about what we talked about?
We were just hoping that, because this is a a grant, and we know that there's an end date to this, that the school board would consider evaluating these roles in the future, and making them comparable, the pay comparable to other positions within the state and at similar school institutions. I know we are kind of on that lower end with Maria's starting salary, and with the tutors' salaries. So although this is a temporary grant, we would like the school board to consider moving forward and evaluating those positions, and maybe contributing to making sure that the pay is equitable for those roles.
Are the tutors, are they in the AFSME? They don't belong to
No.
AFSME?
No.
And she doesn't also, okay.
No.
No, not at all. Okay.
Well, this is a one-time grant, and next year you don't know if you'll get one. So like if we give the raises now, what would we be looking at next year? If we're in a financial pickle, we wouldn't be able to,
Well.
I'm just,
Right.
yeah.
Right. And from what I've been told, there will be funding next year for this same grant.
Okay.
That's what he assured me. For some reason, that my program hasn't been getting cut, and we are getting money in, which is good, so we can use it towards the children and bring more education, Indigenous culture into all of the schools, which this grant has been amazing because Alexander, our teacher, is awesome, and we want to grow the program even more. But like I said, there's a lot of money to be used, and if I don't use all of it, it will not carry over.
Right.
I'll just lose it.
And I think with the role this year, because they have this grant funding, it does equate to more work on Maria's, plate for coming up with ways to spend that money, implementing programming, purchasing stuff for it. So this year, she's gonna be putting a lot more of her time into that, which should be compensated for.
So then let me ask another way. You guys aren't affiliated with AFSCME in any way, shape, or form, so you're contracted basically? So are you year by year?
I'm not contracted. I am paid through federal grants and
Okay.
state grants.
So your wage would be year by year? I mean, like if we gave you the increase that you're asking for, would we be locked in for that wage? It could change year to year.
It could change year to year.
Okay.
And let me also state that it was already budgeted into this grant. So it's already in the grant that this money is allocated for administration.
So that would be my question. So on the proposal, it says proposal cost versus Rockridge Public Schools costs. So the $39,000 a year for your salary, is that above and beyond what we're already contributing? The $39,000?
That's what I get right now through the federal grant.
Okay, so the school district isn't paying that. But basically, what you're asking is if the grant can be used towards a salary increase, but really the Rockridge School Board and our budget and funding isn't affected.
Correct.
Okay,
Good, okay.
They have to have it approved by the school board then to send it into the grantees, is that?
Right, and this is, remember,
To the
school board, this is all contingent upon MDE and the people where the grant money came from. In addition, if you said yes, they still have to be okay with it and
Yeah.
approve it. And this is only until the grant runs out. It's an unusual situation. You have money coming in because of the number of Indigenous students we have. You get X number of dollars. It is always paid salaries for people like Maria and the tutors, the ones who work directly with the kids. I've never seen this much money in a grant come on such short notice that you have to spend within a short period of time. It is unlike any other grant we've gotten. And if we don't spend it, it's all going back to where it came from. And in addition to this, Maria's not really saying this, but we're gonna make her work more. So she's increasing the number of hours in addition to the salary going up. And we're basically, for the tutors, bringing their wages up to what a para makes right now. But these are all folks unaffiliated with any union contract.
Nothing coming out of our budget.
Nothing's.
No.
That's where I was going, yeah, I wanted to just,
Yes.
yeah.
Has the number of students in the program increased
Yes.
this year?
Yes,
So that-
Yeah, it says like over 200
yes.
right now. I mean,
That's
that's
awesome.
10%.
And Maria has some great ideas for other ways to implement language within our community. We were excited to sit down and talk about other ways that they can utilize the funding. And yeah, things that I've never seen on the Iron Range before, so really exciting about that.
That's awesome.
Yeah, that's
I-
really good.
I would like to make a motion to accept the proposal.
I'll second it.
Motion by Luddy, second by Bonner. Any discussion?
The only other thing I'll add is they go through a parent committee and they have a mini board that oversees all this. This
So the
is-
board is okay, this is the board
It's all of,
promoting and.
Our board all unanimously agreed to support the request.
thank you.
Awesome. And you've been involved for a long time. Yeah, so, you know.
Just a side note before we vote, my son is in 6th grade and he has benefited from having, learning some of the language or whatever, and he's come home really excited about it. I just thought that was so cool. You know, I love that because it's, you know, it's part of our heritage around here. So, yeah, thought that was really neat.
Very cool.
Perfect.
Any other discussion? All those in favor signify by saying aye.
Aye.
Opposed? Motion passed unanimously.
Thank you.
Well done, thank you.
Thank you.
Told you.
Thanks for waiting.
All right.
Before we get to the next one, could I just want to acknowledge the middle school football team for their kindness. I was going to mention it at the beginning, but they are pretty neat kids, and the coach and the parents, kudos to them for
Yeah,
having such a great team.
that was a great story.
Yeah, and it's nice to have stories of kindness.
Yeah.
Yeah.
Good values.
Yes, so I just want to acknowledge all of them.
Thanks for bringing that up, Lisa.
Yep.
Randy? We'll move right along. 7.2, consider approval of the memorandum of agreement between the Pine Technical Community College and Laurentian Elementary for the purpose of creating internship experience for the student of the college university.
So moved.
Motion by Reardon,
Second.
second by Bonner. Any discussion? All those in favor signify by saying aye. Aye. Opposed? Motion passes. Let the record indicate it was 5-0. Director Lotiger was not here for that. 7.3, was going into closed session pursuant to Minnesota statute section 13D.05 subdivision 2B. I move in to go to closed session for preliminary consideration of allegations against an individual who is subject to the board's authority. Is there a second?
I second.
Second by Colbert Dahl. All those in favor signify by saying aye. Aye. Opposed? Motion passes unanimously. We are now in closed session.
So what time is it?
All right, at 8:26, we're gonna go back into open session. And can I get a motion to approve or we discussed in closed session?
For the resolution,
Yeah, we have a motion.
I will move.
Motion by Colbert Dahl.
I'll second.
Second by Westby. Any discussion? Hearing none, it's a roll call vote. Director Bonner?
Yes.
Director Westby?
Yes.
Director Yuhan's a yes. Director Colbert Dahl?
Yes.
Director Lotiger?
Yes.
Director Reardon?
Yes.
Motion passes unanimously. Meeting announcements. The next regular meeting will be Monday, November 24th at 6 o'clock at the Rock Ridge Admin Building. Can I get a motion to adjourn?
I'll make a motion.
Motion by Westby. Support by Reardon. All those in favor?
Aye.
Aye. Opposed?
Congratulations on